I'm Dr. John Wycoff, the founder and CEO of the Wycoff Wellness Center, here today to discuss a unique, innovative, and exciting allergy treatment called low-dose allergy immunotherapy, simply termed LDA. LDA immunotherapy is a method of treating most types of allergic problems, including inhaled allergies, food allergies, and chemical allergies. This includes the treatment of allergies to inhaled pollens such as dust, dust mites, molds, animal danders, trees, grasses, and weeds. Nearly all food allergies can be treated, including severe anaphylactic reactions to foods such as to peanuts and seafood. Chemical sensitivities to latex, perfume, and most other common chemicals can be successfully treated with LDA immunotherapy. LDA works completely different from conventional allergy shots. LDA uses very low doses of multiple allergens potentiated with a very specific enzyme called beta-glucuronidase. Beta-glucuronidase stimulates the production of T suppressor cells that effectively switches off the allergy response when you are exposed to an offending allergen, whether it is an inhaled pollen, ingested food, or chemical. Allergies contribute to a number of medical conditions not typically associated with allergy. Allergies often manifest symptoms other than sneezing, nasal congestion, or itchy eyes. Symptoms such as chronic headaches, fatigue, insomnia, bloating, diarrhea, constipation, muscle pain, joint pain, or depression may be caused by allergies. LDA immunotherapy evolved from a process called EPD, or enzyme potentiated desensitization. Some of you may have heard this term. EPD was used for nearly 40 years until the FDA chose to stop this very effective and safe treatment from being administered in the United States. Due to the work of several committed physicians, LDA was developed as an alternative to EPD. Both LDA and EPD are extremely safe. In fact, LDA immunotherapy is the only type of allergy treatment that may be performed in the United Kingdom. Conventional allergy shots may only be administered in a hospital setting in England due to safety concerns. LDA injections may only be administered by a physician and staff that have been properly trained in the LDA process. The Wycoff Wellness Center staff has been trained to deal with any potential problems, albeit quite rare, that may occur with LDA administration. LDA may be used as a primary treatment or in conjunction with other treatments for the treatment of most any allergic condition. Common allergy conditions in which LDA may be used include seasonal allergies, hay fever or seasonal pollen allergies, mold allergy, animal dander allergy such as to cats or dogs, perennial year-round allergies, asthma. Other medical conditions in which LDA immunotherapy may be of help include depression, migraine headaches, chronic fatigue syndrome, fibromyalgia, interstitial cystitis, insomnia, candida overgrowth, chronic cough, chronic sinusitis, autism spectrum disorder, ADD and ADHD, IBS, and many, many more. We've also found LDA immunotherapy effective for several autoimmune illnesses. With an autoimmune illness, your body develops an immune reaction to oneself. The precise cause or causes of most autoimmune illnesses are not known, but research has shown that bacterial infections in the intestines may be the root cause of some, if not all, of these types of issues. We use specific bacterial LDA mixtures in the treatment of autoimmune illnesses such as multiple sclerosis, rheumatoid arthritis, ankylosing spondylitis, ulcerative colitis, Crohn's disease, Sjögren's syndrome, Raynaud's disease, and similar autoimmune illnesses. The actual LDA administration is a very simple process. A small syringe with a very small needle is placed into the skin of your forearm. A small wheal or bump is raised. Some mild stinging may occur at the time of the injection. We will ask you to remain in the office for 30 minutes after each injection to be sure you do not have any type of adverse reaction. The real work of LDA immunotherapy requires participation with you, the patient. There are a number of rules of LDA that must be adhered to with each LDA injection. LDA revolves around the 3 critical days of LDA: the day before, the day of, and the immediate day after each injection. During these days, and often during the next 2 to 3 weeks, you must follow certain dietary guidelines, avoiding offending allergens, and avoiding most medications and supplements. I would recommend you review the LDA Patient Instruction Booklet available as a patient download in the additional resource section of our website for a complete overview of the important rules related to LDA immunotherapy. LDA injections begin just once every 2 months, not every week or twice a week as with conventional immunotherapy. Most patients need to commit to 1 to 2 years of treatment to reap the full benefits of LDA, although most patients begin to see some immediate improvement after just their first or second injection. After you have received 6 injections, we begin to reduce the frequency of the injections from 2 to 3 months during the second year. At the end of 2 years of therapy, nearly 50% of patients will never experience allergy symptoms again. This type of response is unheard of in the world of typical allergy treatments. Some patients may require an occasional booster injection after this period of time to maintain the beneficial effect of LDA long term. The success rate of LDA is over 80%. Conventional allergy shots are only effective about 65% of the time. The complication rate of LDA immunotherapy is very rare. The most common side effects of LDA is swelling around the injection site. In over 500,000 injections given worldwide, there has never been a severe long-term reaction or death. LDA is by far the safest form of allergy treatment available. Your LDA process begins with an initial visit with me. I will review your complete medical and allergy history and perform an appropriate physical examination. If you have had any type of allergy testing done in the past, please bring such with you if possible. We may decide upon further allergy testing such as skin prick testing or blood testing. After you thoroughly understand the LDA process, we will decide upon the appropriate LDA mixture or mixes that you may need to achieve the best result. Many patients receive LDA injections for inhaled allergies, food allergies, or chemical allergies, or have some combination of the above at each visit. We will reevaluate your progress at least once yearly. My office will send to you a reminder each month when your next LDA injection is due. It is important for you to follow the rules of LDA and continue with your schedule of injections every 7 to 9 weeks during the first year of therapy. Allergies can affect your life in ways you may not have even considered. LDA immunotherapy may be the answer to improving your health in a natural, safe, and effective manner. Find out if LDA immunotherapy can help you. Thank you for taking the time to view this educational video. If we can be of further service, just contact the Wycoff Wellness Center, either by phone or email. The Wycoff Wellness Center. Our results can change your life.